I'll now ask my colleague, Dr. JP Nolan, who's the Head of Quality and Patient Safety in the HSE Community Healthcare. I'll give you about 10 minutes to respond to Margaret's powerful words. Thank you. And then we'll get you coffee, don't worry.
Well, I'm conscious I'm standing between you and your coffee, so I won't take 10 because I was asked to come along and kind of think about from the national perspective of myself as a member of the HSE national management team and also professionally as a nurse. To reflect on. I've just listened to Margaret and so what does that mean for us? And it's a difficult task. There's lots of very important points there. I happened to be head of nursing at the Royal College of Nursing in the United Kingdom when Winterbourne View was unfolding on our television screens, and it was more troubling to watch than the worst of horribly imagined fictional drama on TV. And I remember doing quite a difficult radio interview where people dialed in and said, how could this happen? So this was the question, how could this happen? And on a very human level, these people were working in social care and nursing, and how could it happen? And one of the strongest things I heard that I took personally from what Margaret has shared with us is the importance of asking questions, of asking some really basic questions of the situations our patients and service users and members of our communities are in, about their situations, about the many types and levels of vulnerability that exist across the population of Ireland in our communities, and the risk to which those vulnerabilities expose these people. And if we're not asking these questions, how can we take the actions, those immediate and other proactive actions we need to take to safeguard, in the broadest sense, members of our community, whether they live at home or in residences? One of the very challenging aspects for what we do and the way we do our business in Ireland is that our state at some point made the decision that a very large majority of our services would not be statutory. They are not provided by us as the HSE. When we have myriad service arrangements, contracts, GMS scheme providers, unregulated services in the community in the absence of a statutory mandate to safeguard, and that is the climate in which we work. And I suppose over the next 2 days it will be useful for you to think about and us to hear from you through Tim and other colleagues. What does that mean for how we operationalise our new safeguarding policy? Because a policy in itself doesn't fix anything really. And reflecting on the importance of asking very important, very basic questions, for me as a nurse particularly, and as a former director of nursing, thinking about who is it that needs to be asking those questions, and how do they need to be asked, and what do we do with the information we learn? We have over 100,000 people employed in this country in health and social care provision, and everyone needs to be in the position of being able to ask important basic questions and therefore taking the actions needed with the answers they learn. And I think it's a reliance on that individual professional governance and practice for us all, for everyone. And we take your professional lead and your expertise, but for me as a nurse in my own profession, expecting people to also professionally act and safeguard in their own right and their own capacity, and that goes for all of the professions. And I think a dependence on the reviews, someone came along, I only started my job 6 weeks ago. I feel like I've been here in a long time. When you're head of quality and safety for the HSE, you feel like days are very long, because they ask you that classic question of what keeps you awake at night. It's a bit of an odd question, but they say, what keeps you awake at night? I say, well, apart from my husband arriving drunk late from the rugby, there are a couple of things. But interestingly, they're not the big cases that we know about. I'm really concerned that our direction of gaze focuses on the awful ones we already know about. Of course, they're really important, but I am much more concerned about the lack of visibility of a really high volume of layered, stratified vulnerability and the risk to which that exposes people who we do not know about. And that's what keeps me awake. And having a total workforce that we can deploy in all of our services, no matter who provides them, how they're contracted, what discipline they work in, supported and facilitated by experts such as yourselves, sorry, to ask those important questions and act on them decisively when we need to. So I'm looking forward to hearing from your own reflections over the 2 days. I'm working with Tim and his office and yourselves as we look forward over the next couple of years to operationalising the safeguarding policy, but hopefully doing that in a way that impacts culturally in the organisation, because everyone says that, but I've yet to see that nut being cracked, and I hope we can take that task on together. So thanks very much.